If something has to move from point A to point B, it would need resources. And if different things have to move from point A to point B, then they have to compete for these resources. And for competing these resources, they have to come up with plans. And that plans would be about the best or the optimal use of these resources. So here comes planning into action. So do you want to know more about what is planning and how do we do planning, especially in the healthcare sector? So if you want to know more about this, stay tuned and I will explain it right here on this channel, which is known as the medical channel, which means the world of public health, epidemiology and pediatrics simplified. Welcome to this channel, and if we haven't met before, my name is Dr. Syed Kazmi. I'm a pediatrician and I also have a background in public health. I try to make videos on different topics which would be of interest to the general public as well as to those people who are working in the field of pediatrics, epidemiology and public health. So let's talk about planning. Planning is defined as optimal use of limited resources. And let's dissect this definition. Optimal use of limited resources. Very simple one sentence definition. Optimal means the best use in given circumstances. Best doesn't mean that it has to be like top of the world, but best means that it would be the best alternative in your given circumstances, which can vary from one scenario to another scenario. And when we say limited resources, it means that resources, whether they are financial resources, whether they are human resources, whether they are material resources, whether that's information resources, they are always limited in nature. And this is one of the inherited nature of the resources, that they are always limited. Even if you think that resources are too much, like for example, in case of a rich country, still these resources have to go in different directions. There is always an opportunity cost of everything. Opportunity cost means if you are doing something with that resource, then you are not doing something else, and that not doing something else would be the opportunity cost of this resource. So for that reason, you have to make sure that whatever resources you have at hand, you make the best use of it. And that is what we call as planning. So planning is futuristic in nature because you are trying to make the best use of your limited resources. Now, how does planning fit into the context of healthcare sector? Now, healthcare sector is all about providing healthcare services to the masses. That would mean providing them with the primary healthcare services, that would mean providing with the secondary care services, and also means providing with very specialized and tertiary care services. So the resources that any country or any system would have, that resources would be in the form of financial resources, that is the money, and the money usually comes by involving the taxes, the general taxation. So if a government gets revenue from general taxation, then it has that what we call as the national exchequer, and that money somehow, some part of it has to be invested in the healthcare sector. Similarly, then you have got the human resources, which are your service providers, like the different types of personnel that provide. That would include doctors, that would include paramedics, that would include nurses, that would mean auxiliary, that would mean the health care management personnel, so on and so forth. And then you have got the material resources that would include your equipments used in the hospital, that would include your logistics, that would include the different types of diagnostic modalities that are used. And then finally, you have got the information, that is the type of information that you can use to make these decisions. So all these resources have to be put in such a way that you make the best output from these resources, and that is what we call as planning. So planning is always done in a cycle or in a cyclical manner, which we call as the planning cycle. The best book to know or read about health planning is An Introduction to Healthcare Planning by Andrew Green. That is what I normally recommend to all people to have an understanding of what healthcare is all about. It's one of the best books which have been written on this subject. Nevertheless, coming back, so health planning is a form of a health planning cycle. So it means that you start from somewhere and you come back to the same part again and again and again. So it is occurs in a cyclical pattern. So any planning process, whether that's the healthcare sector, that's the energy sector, that's the education sector, or any other sector, it always and always starts from some baseline information. Remember, you cannot make a plan unless and until you have got baseline information, and that baseline information, which we also call the ground information, is all the information that tells you where you are standing at that point in time when you are about to make that plan. So that process of getting information is the beginning of the planning cycle. So the very first thing before you can make a plan is to know where you stand. In the healthcare systems, it's important to understand where the healthcare systems stand at that point in time. And the process of gathering this information is known as what we call a situational analysis. So situational analysis, the word situation means what situation are you in, and analysis to analyze. Where do you stand? So situation analysis in itself is a form of a systematic collection, analysis, and interpretation of data to help you understand where do you stand at that point in time. So for healthcare systems, that data can come from different forms. That data can come from the national census. That data can come from the budgetary documents. That data can come from the service. That data can come from the national databases, and that can come from other resources, international resources as well. So you have to collect that information, and it's not only about collecting the information. That information which has been collected has to be analyzed. You want to know what does that data means. Like if you have got records of like 100,000 people who are suffering from some form of illness, does not give you any information unless and until you know, you analyze that, okay, fine, of these 100,000 people, who are poor, how many are rich, which age group is being affected, which geographical area is being affected. So that would all come by analysis. So data once collected has to be analyzed and then interpreted to make some form of logical conclusions from that. So that's why situation analysis, which is the first step of the planning cycle, is all about what? Collection. Number one, collection, then analysis, then interpretation of data regarding healthcare services. So once you have done that, and it's usually the job of the planners to analyze this data, to interpret this data, to make themselves and the governments or the public health systems to understand where they stand at that point in time. Because you need to know where you stand. If you want to go somewhere, first of all, you need to know where are you at that point in time. And that is something which you can only get by doing situational analysis. So situational analysis data, as I told you, can come from national databases, it can come from budgetary documents, it can come from national census, it can come from different form of registries which are kept for different purposes, so on and so forth. So once you have collected, you have analyzed, and you have interpreted that data, then the next step is to see how you can move where you want to move. And that second step is known as options appraisal. So options appraisal is, for example, once you have interpreted that information and you know where you are and where you want to go, then from, in other words, going from point A where you are standing to point B where you want to go, you can take different routes. You can have a drawing, like sort of a straight line which connects A with B, or you can have another circular way which goes to some other point, let's say C, and then goes to B. So there would be different ways of moving from point A to point B. And every path of, possible path of moving from that point A to point B, A is your present, B is your future, you can have different options. And you have to weigh the options. You have to weigh the pros and cons of each and every option. And that process of weighing the pros and cons of each option is known as options appraisal. And options appraisals can be done in a variety of different ways. There are qualitative methods, there are quantitative methods, there are statistical methods of doing that. I mean, this is a whole sort of a subject in itself. But nevertheless, to make it very simplified, you can have very simple qualitative methods of doing option appraisal. So you take all the options and you measure their strengths, weaknesses, and at the same time you look at your opportunities and threats, what you have at that point in time. We call it the SWOT analysis, SWOT. S stands for strengths, W stands for weaknesses, O stands for opportunities, and T stands for threats. So for every option, you would do a SWOT analysis. And what does that SWOT means? You will look at the strengths of that option. What are the pros of that option? And then the weaknesses. There must be some inherited weaknesses of that particular option. So you also look at the weaknesses of that option. For example, some options might have some knock-on effects. They might be producing certain problems. That would be the weaknesses of that option. And at the same time, given the overall economic and political scenario at that point in time, you can have opportunities and you can have threats to that particular option. So for example, if you are going through an option which has got a lot of public support, that is an opportunity for that particular option. In the same manner, if the people are against, or you think people will be against that type of option, then that is a threat. So you would look at the opportunities and threats. So opportunities and threats are mostly extrinsic, outside of that domain. They are usually political and economic in nature, while strength and weaknesses are mostly intrinsic to that option. So that is something which is the sort of pros and cons built in within that option that you are considering. So SWOT analysis, strengths, weaknesses, opportunities, and threats, is one of the simplest form of option appraisal, and you don't need to have hundreds of options to appraise at the same time. 3 or 4 options are more than enough to appraise, which you are weighing to see which would be the best one to move from point A to point B. So you look at the SWOTs, and the one which has got highest strength to weakness ratio, that should be your option scientifically. Then there are other methods of doing that as well. There are what we call as looking at different factors. Again, these are qualitative methods. So you look at what would be the political acceptability of that option, whether current resources are available to pursue that option, what is the urgency of them, whether that option has got an urgency component to it. It is something which is like, for example, a natural disaster which needs something to be done at that point in time is more urgent as compared to something like a non-communicable disorder which can be tackled over a period of years. So urgency is also something. Obviously urgent things would be tackled first since they are more urgent. So political acceptability, availability of resources, which would be financial resources, trained manpower, whether it's available or would you need to train it for them. So if you've got something which is readily available option, that is sort of a strength for. And then obviously what is the amenability to change. So if some options are such that they are relatively easy to change the situation, some options are a bit difficult or there's a bit of uncertainty about them. So again, you can score 1 to 5. Those which are more easy to achieve, you would give a high mark to them, let's say 5, and which have got like you think probably it would not be easy to achieve them, then you give them less marks. So for every option you do that scoring, and the one option that scores the highest becomes your option that you should be selecting. Or there are other methods, economic methods, statistical methods, cost effectiveness analysis, cost benefit analysis, cost utility analysis, cost minimization analysis. These are different types of economic analysis which you can use for different options to see which one would be the best in the given circumstances. For example, you can do, if you are comparing different options, same type of options, then you can use the cost effectiveness analysis to see which should be your option to pursue. If there are, you are comparing apples with oranges, different types of programs which move in different directions, that can use the cost utility analysis to see whether which one of the option would be feasible to pick up on and pursue to reach your goals. And if nothing, then you look at the cost minimization, that for given output, which program would give you the minimum, like which would be something which would be the cheapest to achieve. That cheapest doesn't mean that it has to be cheapest in the sense that you would compromise on quality, but given the facts that what are your baseline standards which you want to achieve, which of the option would be the least expensive. So that is the cost minimization. So in this short video over here, I will just stop because today in this introductory lecture, I've just talked about what is planning, that is the optimal use of limited resources. And I also talked that planning is a cycle, and this cycle always starts with situational analysis, which is all about knowing and interpreting where you stand at that point in time, and then taking it from that point onward. So you know where you are and where you want to go, and then when you want to go, then you have to look for different options, and then each and every option has to be weighed scientifically. And I told you that there are different ways of weighing these options. It could be the SWOT analysis, it could be the other types of qualitative metrics, numbering, or it could be statistical or economical methods like cost effectiveness, cost utility analysis, etc., etc. So I will stop here, and I will see you in the next video, which would be continuation of this introduction to the planning cycle in healthcare services. Stay healthy, stay safe. See you next time. Bye bye.